I never blinked an eye. I never had one apprehension about having this. I would recommend it to anybody. When I had my implant, I had a nurse sit beside my bed the whole time I was waking up. I mean, I was shocked that I could have somebody with me all the time.
By the time we went to get the surgery, it was a breeze. I mean, I was ready. I knew that everything had lined up. All I was worried about was that hair falling on the floor. It didn't happen. My right hand was shaking more than my left, and they said all we have to do is tune it up. At that time, I felt a little bit of a tingling. Corrected it completely.
When you get your equipment, the DBS people that provide this are on call 24 hours a day. You can dial an 800 number and ask them anything you want to ask. And they will help you, because everything's new and you're afraid you're going to do something wrong.
The UNC Deep Brain Stimulation program is patient-centric. What I mean by that is we want to spend time with you to get to know you and get to understand what are your priorities, what are your goals. And we provide you information so that you can make that decision about whether DBS is the right fit for you to be able to then overcome some of the challenges that come with tremors and other disorders like Parkinson's disease.
The best time to consider undergoing a procedure for, particularly especially for tremor cases, is to really have someone evaluate carefully what your tremor really looks like. It is true that no two tremors are alike, and as a result of that, no two treatment options will be exactly the same from one person to another. Having a proper diagnosis of what's causing your tremor, having an understanding of what has worked and what hasn't worked for your tremor thus far before proceeding with surgery will be really important points for your neurologist, your movement disorder specialist, and ultimately your surgeon. At UNC, what we would like to appreciate from you is an understanding of your treatment course over years, months, what have you, just so that we can better understand how we can serve you through the multiple treatment options we actually offer through an interdisciplinary approach.
What all of us are trying to do is we are trying to understand how we can best serve you and how we can make this treatment as easy and as accessible to you. So the surgical procedure involves three main steps. On the day of the treatment, you go to the operating room, and the first part is where you are asleep for the procedure. The second part is where we temporarily wake you up for about an hour or so to do testing. And then the third part is where you are asleep again and where we then close up and finish up the procedure. So going back to the first part of the procedure, you come into the operating room and the anesthesia colleagues administer anesthesia so that you are asleep and comfortable. We do a head shave while you're asleep. And then during this part, we then open up the skin, drill very small holes in the skull, and implant these testing electrodes. We call those micro electrodes that allow us to very precisely understand the internal brain anatomy. We then move on to the stage 2 of the operation, where we temporarily wake you up and do testing. And this part is critical to understand because this is a awake procedure where we have the chance to test whether the stimulator is working, it's improving your symptoms, and what kind of side effects are we noticing because of the stimulation. And this gives us a chance to then modify the placement to an appropriate location so that the stimulator can serve you well 10, 15, 20 years down the line. So it's a very powerful technique that allows us to make adjustments while we are there in the operating room. And the testing part can be helpful. Having said that, in some patients, when It's not medically indicated. We also do this procedure asleep as well. Once we are done with the testing part, then we move on to the third phase of the procedure, which involves implanting the permanent DBS electrodes, closing up. And for that part of the procedure, you are asleep.
When they put me to sleep for surgery, I thought, oh, they're shaving my head. And that was not a big deal. Don't care. It grows. And I've kept it this way. I like it. And everybody thinks it's cute. And I'm too old to be cute. So there you go. But I never worried about it. Never.
I can, if I end up getting shaky, I can adjust my shakiness by turning it up one notch.
And this is my adjuster. You turn it on and you can adjust either hand, but you can't do them both at the same time. You can bump it up a little bit if you start noticing tremors. Now, I have used my right hand one time after I got back from my 6 months checkup because they convinced me I wasn't going to do something wrong. And you can lessen it or increase it, but just at small steps.
What patients most often tell us about our program that we're excited to hear about is the fact that we take the time to listen to their stories. We take the time to truly be invested in the specific care of that person and that person's tremor type.
The doctors are capable. The doctors know what they're doing, but there's no team like UNC doctors.
This was piece of cake. Nothing. I mean, I can do anything. Now, you'll have sensations in your hands, and you will, especially when they first start it, and I think you just get used to it. They're little tingly sensations. But the minute they turn it on, you're well. It's not a gradual thing you grow into.
A lot of people have had it that I hadn't known about. A lot of people know what a miraculous surgery it is. I am still a part of that DBS group online, and time after time after time, people are saying, what are the results? What are the drawbacks of having it? I can't tell you a drawback.